Okay, good morning. We do have a quorum today, so we will call this board meeting to order. All those here in attendance are at the table, and then Amy Height, board member, will be joining us virtually later on this morning. We do not have an on-site packet today, but we do have some additions and revisions to the board agenda. We have 2 executive sessions that we'll need to add. Do you want to give any intro to those, Carol? We have motions at the table for review if someone would like to get us started.
We do.
We don't.
You mean to amend the agenda?
Oh, but nothing specific to the executive session. We'll just do that when we break for the executive session. Okay. So we'll add 2 executive sessions. One is about cybersecurity and then an official review. And then we will remove from our new business, the annual delegation conversation. And then we will add to new business discussion to schedule an additional Board of Nursing meeting.
It's a Zoom meeting when it's coming up of the computer.
No, not yet. Hold on. Fully virtual meeting to review the APRN regs. Do you want to add any additional to that? No. Okay. So those should be the additions and revisions for the agenda. Any discussion on that? Now we have.
Madam Chair, I move to approve the agenda as amended.
Here.
Madam Chair, I'll second.
It's been moved and seconded. All those in favor say yes.
Yes.
Anyone opposed? No. Extensions, motion passes. And then we'll move to announcements. We do have a couple people that we would like to recognize today as the Board of Nursing. So I will just, one person is here with us and one is virtual. So the first is Nolan Jones with Tyler Technologies, and ask you to come up.
Sure.
Here and join me if you would. Let me say I have this nice piece of information.
Okay.
Also, I've heard so many good things
Oh,
in
good.
preparation for this, so thank you for joining us today. It is with great appreciation that we recognize and thank Nolan Jones, the General Manager for the Kansas Tyler Technologies, for his nearly 18 years of unwavering service and partnership with the state of Kansas. Your contributions have been instrumental in advancing Kansas's digital governmental initiatives, making our state a leader in technological innovation and public service delivery. Through your dedication and expertise, you have provided superior technology solutions that empower agencies across Kansas to serve our citizens with greater efficiency, transparency, and accessibility. Your commitment to excellence has not only supported our shared mission, but also demonstrated what true partnership looks like. Collaborative, innovative, and always focused on delivering the best outcomes for the people of Kansas. On behalf of the Kansas State Board of Nursing, we wish to extend a special thank you for your ongoing support of our operation. Your management of our online technology solutions have allowed us to streamline our processes, improve service to nurses across the state, and ensure that we continue to meet the highest standards of regulatory excellence. This partnership has been a cornerstone of our success, enabling us to focus on protecting the health and welfare of Kansas. As we reflect on nearly 2 decades of collaboration, we are grateful for your steadfast commitment to helping us achieve our mission. Thank you for your invaluable contributions and for being such a vital partner to both our board and the state of Kansas. We wish you all the best in your future efforts.
Thank you very much. Yeah, I mean, say, I feel like I should be thanking you all. Back in, thank you very much. Back in 2022, my wife unfortunately was diagnosed with multiple myeloma. And during her stem cell transplant, her appendix burst, and 27 days in the hospital and still back at KU again yesterday, but it was the amazing assistance of the nurses that honestly got us through all that. So I want to thank you all for the regulation, keeping all that top-notch talent and all the wonderful things that allowed me to go home and show my wife this wonderful flag. Appreciate it.
Let's get a picture.
Oh, sure.
Thank you.
Thank you. Thank you, Trent. Thank you.
And then we also have Marianne Alexander with NCSEN.
Where'd she go?
Trying to get her.
She was on there.
Yeah, we just lost her.
So maybe we'll give it just a moment
Okay.
to see if
Something they
we're able to reconnect.
Let's see if she. Probably getting her patch. But that was patch night. Probably patch she's gonna be. Here she comes. She's coming. It looks like she's not there yet, but getting close.
I'm going to take that because now I know what setting we're doing.
Are you there,
Okay.
Mary Ann? Hello? Can you hear us okay, Mary Ann? Here we go.
Ah,
There she is.
we can't hear it now.
Having a little technical difficulties, although I think it's been good.
Hear them.
Okay, perfect. All right, thank you. Hello, everyone. I'm so sorry about that. I wasn't getting a good audio, so I had to call our help desk to come do a little technical fix up.
Well, we're glad you got that resolved. Thank you so much for joining us this morning. Sorry you can't be here with us, but I just wanted to give a little thank you and let everyone know here sort of what we're recognizing you for. And then we will get a certificate to you showing our appreciation. So on behalf of the Kansas State Board of Nursing, we extend our heartfelt gratitude for your remarkable 18 years of service to NCSBN. Your visionary leadership has left an indelible mark on the nursing profession and regulatory landscape. Your testimony to secure the autonomy of the Kansas State Board of Nursing from the medical board's oversight demonstrated your steadfast commitment to preserving the integrity of nursing regulation. Similarly, your tireless advocacy for the Nurse License Compact has expanded access to care and exemplified your dedication to breaking barriers for nurses and patients alike. Your legacy is reflected in groundbreaking initiatives such as the Journal of Nursing Regulation, the International Center for Regulatory Scholarship, and your data-driven approach to policy development. These achievements have not only elevated the profession, but also ensured that public protection remains at the forefront of everything we do. Your energy, optimism, and unwavering belief in the power of regulation to make healthcare safer will be deeply missed, but your contributions will continue to inspire us for years to come. We wish you all the best as you transition to the next chapter of your life. With deep appreciation, the Kansas State Board of Nursing. So thank you, Mary Ann.
Thank you very much. My heartfelt thanks to all of you. And I just want to say I have so many memories of working with members from the Kansas Board of Nursing throughout the years. You all have done so much to shape regulation, to shape the work I've done. The memories of working with you, the fun we've had, the hard time challenges that we face together will always be a lasting memory for me wherever I go. And I've certainly learned so much from you as well. So thank you so very much. And this is an honor of a lifetime, and I can't tell you how much it means to me. So thank you all so much, and please stay in touch.
Thank you. Thanks for joining us this morning.
Thank you. Bye-bye.
So before we move to our approval of minutes, I thought I would ask Charles to introduce our new face at the table.
Yes. I'm Charles Macheers, your general counsel, and I'd just like to introduce my colleague Jesse Burris. He's works with me down in the logic division, so he's just visiting with us today.
Hi, everyone. Good morning.
Thanks for joining us. So we will move to the approval of minutes. The board had that in our packet, so I'll give you a moment to review if you need, and then we can entertain the motion.
Madam Chair, I move to approve the minutes from the September 11th, 2024 board meeting as written.
We have a motion. Is there a second?
I'll second. Or Pesa.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion passes. For the consent item agenda, we did review that at our last meeting and approve that contract. It has now been signed and it will move into effect January 1st, 2025. So we'll move to agency reports and start with Cheryl.
Thank you, Madam President, board members. You should have mine under staff reports, I believe. And just to kind of tell you, we're trying this new format, all of us, with our staff reports. And so hopefully they're all gonna start to look a little bit more alike. And we're trying to tie back to the strategic plan that you all set up as far as what we're doing and why we're doing it and stuff like that. So you have, the stuff about budget and all of that. The budget is going through the process. It went through the special committee on budgets, which is a new thing. And then we're waiting now for the governor's budget to come out after the session starts. And then we'll have the budget hearing in both the House and the Senate. So it's not all the way through yet, but it's getting there. One thing that we have done is we've seen an increase in audits that the state is doing. And there's always changes to their procurement and all of that. So we, as a leadership team, have put together a process to learn that better. We've met with some of their leaders down there. And so we're starting to understand. It's a lot for Jill. She handles a lot of that, but we're here to help her. We did go to a Kansas Agency Business Summit that was very helpful. Adrienne and Jill and I attended that. We have revised the agency travel reimbursement fund or process so that we get more consistent knowledge from our staff as far as how they're going to be reimbursed and stuff like that. And then as far as recruit, develop, and retain qualified staff, we did hire our part-time assistant AG, Sydney. And so some of you probably saw her maybe in the investigative, but she's very good. We're very happy that she's here. We still have a half-time AAG position posted. So hopefully we'll get some names on that. We have taken one of our open positions and reworked it to be a public information officer. We heard you in the retreat saying that you felt like we needed someone who would be kind of an eye over in the legislature to listen and see a few more things if I'm not able to be over there and stuff like that. So that is part of the responsibilities that they would have. They're also going to have Cora. They're gonna have our coop. They're gonna be the agency record officer. And they're also going to help with regulation revisions, which is really needed, because right now I'm the only one that knows how to do it, and I don't like that. And then the other part will be the legislative awareness of the bills and the actions that impact KSBN. We have it posted. We're hoping that we'll get some interest in it. It'll be an interesting job, but it's basically going to be handling information that could be with the public, you know, the Cora, all of that. So it'll take a little bit out of each of us, what we're doing, like Linda does Cora, I do the regulation, I'm the agency record officer. Adrian kind of does the coop and stuff, so it's gonna help all of us. So we'll keep you posted on that one, we're real excited about that. And let me see, I'm just gonna try to hit the high points. We do have on the agenda a little bit later about vendors, possible vendors for our newsletter, our annual reports and our strategic plan. So that fits in with communication that we provide. So hopefully something can get decided about that. We had a public hearing for 60-3-114, the revisions that you made in that. So you're gonna hear about that a little bit later. One thing that you have at each of you had this there. You may wonder what this is. We did this last year. We had this one-page sheet for the legislature. And it just kind of overviews things about the Board of Nursing. Because you get very little of their attention, that there's some things that we really want them to know. So it just kind of highlights. We do have some back there for the public and stuff, and we can get more things like that. But I did want to draw your attention to the second page because, you know, we're hearing about nursing shortage and there is a nursing shortage, definitely. However, at the top, you will see that our number of licensees at the end of fiscal year 24 was up from fiscal year 23. And I think that's an important thing. It's the first year that has been going up. So if you hear, you know, that is feedback that you can definitely give people, is it did go up. So this will be given to each of the legislators when the session starts. So they'll have that. And let me see. Other than that, the only other thing, and this is not on my thing, my staff report, because it's happened since that was done, is our agency has been one of some agencies, there's not a lot, that has been chosen to be part of a legislative post audit. And it's about evaluating state agencies' registries of perpetrators of abuse, neglect, and exploitation of persons with disabilities. What they're, I think, trying to achieve in this is seeing how each licensing board kind of shares their information as far as if we had someone like a licensee that had done abuse, you know, or something along that line, how maybe another agency would know that. And so it's going to be interesting to hear, you know, what they find out. They're meeting with us next week to start, and they hope to have it finished by April. So hopefully it'll be pretty much finished, our part, by the March meeting. We'll meet again. So I think that's all I have. If there's any questions for me or anything.
I had a quick question, Madam Chair. That new position that you're arranging, is that full-time, part-time?
Full-time.
Full-time, thank you.
And it is on our website.
Okay, thank you, Madam President, members of the board. You should have my report. You'll see two areas of action that will come out. One is the approval of the continuity of operations plan, and then the second one is came in since this report was created, is the review of the information security policy for the Board of Nursing. Those will be talked about in the executive session, but those are the two action items that will come out of that. It's been another very busy quarter. We've been involved in a lot of different groups and task force and trainings and those sorts of things this past quarter. you'll see some detail of, what some of the staff, have attended. Rayanne and Tony, myself, have been going to various areas, training and conferences and those sorts of things to keep our knowledge up. Probably the biggest thing that we've had since this last quarter, is we're basically completing the phase 1 of the My License Office project. We do have one portion that we kind of moved into the second phase, which has to do with the reporting mechanisms and then the mobile interface. So that'll be tied into the phase 2, but the phase 1 with the upgrades of the system, all the security stuff, the deployment of the new verification system, all of those were part of phase 1. And we did have, as a reminder for those that maybe didn't know, we received some of the Spark funding, which is the CARES Act money. That money is basically coming due, so we had to expend all of that by this month, I believe. So we're completing that out, closing that out with the state here, probably this week, actually. So that's good to get that done. And then we've had a real big kickoff with the phase 2 deployment, which will include those 2 items, but also the biggest thing is the My License or the Evoke investigative and discipline components. Linda and her team have been doing a lot of work with us. We've been meeting with the vendor weekly, going over some ideas and things that we want to be able to do. Whether or not we'll get everything that we want, it seems to be seen, but one of the things that we'd like to have is a portal so that like the investigative committee can sign in and be able to get into those a little bit easier and do those reviews, as well as Carol and Linda and the investigative team. So that'll be good. And so that's moving along nicely. We've been doing a lot of work with the records management, various things with the, it doesn't seem real important, but we have some old paper records that we're getting transferred to the archives, that'll actually help with the aesthetics of the office a little bit, because there's some really old cabinets up there that we're getting moved out. We have since closed out the Mills Record Center. Sharon Oxby, who's our records management imaging person, has done a real good job getting all of that indexed for us and getting it ready. So making the office look a little nicer too, if anything. We continue to work with the ArcCase software, which is the Kansas Open Records tool that we're going to be using. We're getting real close to the end, I think, whatever we get shooting for January, right? Somewhere in there.
I think I divided it into 2 because we'll get something by the end of this month, and then hopefully by the end of January, we'll be closer to doing the other one. Yeah.
Good. So we're lucky that we have Linda and Stephanie working on this project as well. So we've been doing a lot of sessions with the vendor, and they're very nice people to work with. So we're hopeful that we'll have that ready to go here soon. And then probably the biggest thing that you guys are going to notice is the new laptops. We're getting those. We had to change everybody to Windows 11 by mid next year. So we thought that this was the opportunity to go ahead and do this. Tony's been working to get all the security software and those sorts of things. One of the things that we'll ask is, and I guess I open it to your preference, would you rather try to do this over lunch, or would you want to do it after the meeting, come up and sit down and do kind of a little session?
Sure.
After, okay.
Whatever you want to do, but mine's gonna take a minute.
Okay, yeah, and we've got a few, and that's the other thing too, if we have some files and stuff, we might have to go to each one, because we don't have a whole lot of those USB drives, but we'll get it transferred for you. And basically the biggest thing that's gonna come is it'll look just a little different. The Windows icon, instead of on the left side, is gonna be in the middle if you have it at home. But you'll have the Adobe, the Word, your email, all that kind of stuff is basically the same. But it will help us with our audits and those sorts of things that we've been doing. One of the difficult things, we do continuous scanning and those sorts of things of the devices, but because you guys are only here quarterly, you might check once a month, but it might miss the patch day, so it's a little bit of a struggle to figure out how to make that all sync. So this gives us the opportunity to just get everything fresh and we'll be good to go for a few years. So, but we also do that with staff. We're doing it internally. We're moving everybody off desktops, and everybody's getting the laptops and the little docking stations so that they're a little bit more mobile. And then we hold what we call like a tech check day every month in conjunction with our staff meetings, so that staff that have any sort of issues, or if we do have to deploy patches or something of that effect, we have everybody available at one time to do that. So it's been a lot of work. Colton and Tony have been doing a lot of work on that stuff. So they're doing a good job keeping that all ready for us. Other than that, that's basically my report.
I have a suggestion because we've done that where I work. You might want some hard stations too, because sometimes when these do their little thing,
Mhm.
but they've got to keep, you got to keep going
Yeah.
unless you got a spare laptop.
I noticed that this morning with that one. I don't know if you saw me struggle over here trying to get that machine going.
But that is, you know,
Yeah.
we finally had to find a room that had what you call the hard dock, because it's like, do we have those anymore?
We actually won't be getting like the scanner machines we have, they're connected to the big scanning stations. Those are actually gonna remain, and all staff could log into those and just work off of them if they want.
Okay, just
Uh,
a suggestion.
It's been nice though, you know, with the staff that we do a lot of work with teams, and like Colton does the tech support and those sorts of things with it. It's been neat to see the change. And it's allowed us to, you know, freshen up the office too a little bit, made it a little more, you'll hear in the continuity of operations plan, you know, we hopefully won't have another global pandemic, but if we do, I think we're ready, you know. So, the other big thing that we're doing, that you're gonna hear about is the information security, and we'll go more into that during those sessions, but we've been doing a lot of rollout of multi-factor authentication and all that kind of stuff that it's just been a lot of underneath things that you don't necessarily see on the outside, but there's been a lot of work underneath. So doing our best.
Thank you. I think, as you said about just the hybrid work, I thought too, when I looked at Carol's report, I just kudos to your team for just continuing to reevaluate how that's going for folks. How do you pull in some in-person time in addition to offering that hybrid work status? So I did a great job with that. Any other questions for Adrian? Would like to go next, Linda?
Sure. My practice specialist staff report is the same format that we are attempting to use. And I'm attempting, so thank you for bearing with me. And like Carol's and Adrian's, this report is an update of activities in the investigative division. And I've attempted to align the activities with the KSB and strategic plan initiatives as indicated in the various sections of this report. So the data is the first section. So it was believed that this is important information for the board to continue to see. So I've kind of like streamlined it a little bit more for complaints that are currently received alleging unprofessional conduct and the applications requiring legal review. We continue to update our internal processes to meet the performance-based metrics that the board sets. So currently for applications with legal review, we had 80 at this time of November 20th that we still had currently open. So those we do meet weekly now. We were meeting every other week, but we meet weekly for application review. Starting January, we'll start meeting weekly again. But those will hopefully be, we have some ways to be able to do some of those, like for reinstatement applications with unlicensed practice. We do those via email, so we can get the nurse reinstated faster and be able to get them back on the floor and into the workforce. So we do have means to be able to do things like that. So complaints, you know, the significant investigations are things of concern. Those include the allegations of abuse, neglect, exploitation, drug diversion, and workplace impairment. And then we are still currently only seeing about 20-25% are sworn complaints. So we are looking at our internal process with design of this Evoke case management system. We're able to kind of like drill down further into how we're reviewing complaints and redefining our procedures so that we can look to see, do we need to even open the case? We do not open cases when there is no licensee identified. Sometimes we get complaints, which is a first name. Well, we need a little bit more information because there's several Marys out there that we don't know if they're the right one, but
And if there's no violation of the Nurse Practice Act, either alleged on the complaint or even during the course of a case investigation, the evidence doesn't support the allegation, so those cases would be inactivated. So that's what we find as well. All of those cases that we review, the complaints that we review, all of those go into a spreadsheet for the investigative committee to review to see if they agree or disagree. And if they disagree with our inactivation of a case or a complaint, then they have the option to tell us to open that case. So there is a double check system in place. We do have some barriers to collecting evidence from facilities who fail to respond to subpoenas still. And that was discussed, I think, in investigative committees. We have some ideas. We also put together the chart from NCSBN about the discipline cases, and you'll see kind of on page 2 of my report, there is an uptake in about October-ish, and that's probably where Sydney came on to be able to help us get some of those cases processed through disciplinary action. The open records is, like Adrian said, continues to be received and timely performed. We're hoping to have that ArcCase software rolled out for the mailing list instructions. We do have to the end user instructions that I received from ArcCase have to deal with federal requests. So I'm trying to take what they've done and make it into what we do so that I can send that to our end users so they understand how to work a portal system to ask for the documents and request. So that's a little bit of a time consumer, but I have Stephanie now as of last, September when she started. So she's on board. So we're really trying to get this thing up and running. So, so let's see what else. One of the biggest things I think about the Evoke case management software system that we're looking at implementing, and like Adrian said, we're shooting for the Cadillac, we're asking for the Cadillac, we're sold for the Chevy, but we're going to ask for it because if they know that there is a need, perhaps they can hopefully design it at some point. But we are also developing algorithms to kind of like see kind of the process for when applications are reviewed, as well as the complaints that come in and all the different types of complaints that we have, because there's different evidence that is supported for each one. So it's helped us look at all of our procedures, our forms, everything, our letters, everything. So we may be asking legal counsel to kind of like help us, make sure that some of those things are, correct, and reviewing them again. So that's really been helpful. I have gone and done some presentations. And the last one I went to was Washburn Tech School of Nursing, and I've been asked to come to their PN leadership class every semester. So they were a very good group to kind of visit with. So they're kind of scared of Board of Nursing, but at the same time, they were fun. Great group. So, thank you.
Any questions? Thank you. Appreciate all the
Madam President, members of the board, Janelle Martin, Education Compliance Officer. So yes, you were seeing a new format for our staff report. So this was a little bit of a challenge, but probably good looking at the strategic objectives to look at what we're doing. So in the oversight of programs, we did 4 visits this quarter, which included 2 reapproval, a follow-up after first graduation, which went well, and an initial visit. We did, what's kept me probably most busy this quarter besides the site visits are the annual reports that came in, 62 undergraduate programs and 9 graduate programs. Those were all reviewed. They all submitted timely. We've had a couple of glitches, but they were able to get it in. And so all that data has been reviewed. The NCSBN sent us our core data report, which was part of the education packet, if you haven't seen that. And all were verified. I am working on trying to kind of align what the as they try to take faculty out and put new in, I'm trying to kind of follow that with them and keep track of what our faculty truly look like. In the second part, it talks about the FQRs again, and I continue to put that in there just because I think it's important when we're talking about the oversight and looking at how we're doing with faculty. And one thing I haven't put in here, but for the most part, we're probably getting I'd say 85% of our FQRs within 30 days. We do still have some that are a little less timely, which, you know, usually we don't have too many we would ever deny or might come to you, but I think that's important to know that I think, but for the most part, they're very compliant. We have a couple schools I'm working with, and I know some of that is just getting all the information because they're required to send us transcripts, and sometimes that can get a little challenging when they have faculty that are busy as well. But we did look at I processed over 400 FQRs this year, and that's an uptick from the last 2 years. We were close, but this is the first year we've gone over for a while. But 55% of those were initial, so those were new faculty. Also kind of note is that 56% of those FQRs had either higher exceptions or degree plans with them. I don't think I broke that down, though I could further to see, because we do like to see the degree plans, but we know that it's been a tough year again. I think it's getting a little better, but we are still seeing a significant number of higher exceptions. So we try to support. Most of the time we have a higher exception process where they have to tell us more about the qualifications of the person. And I think that's been helpful. I've tried to get a little better idea of what they're actually doing to get qualified faculty and have them be a little more specific about that, because that's what the regulation asks for. And they've been really good about following up and doing that. So appreciate that. In terms of communication, I've been doing a lot more. NCSBN has a place for education consultants and probably others as well, but I get a lot of surveys, and it's very interesting. I've been trying to follow more of the surveys that are out there from other boards of nursing, because I've also submitted them when we've talked about simulation hours, when we've talked in education, when we've talked about faculty, there's several things that we've been able to benefit from surveys that are done by other groups as well. And so I continue to fill those out because I think it's important to get that information that people are asking for. And it's also a way for me to go back and get that information and bring some of it back. And I'm going to try to do a better job. I think there's some good information out there to bring that back to our education committee. Some of those things to think about. I think they do come up with some really interesting questions. I think everything else, a couple things. We are looking at the LMHT still. We had a task force that was in place. We're planning to reconvene the task force, but for different reasons, we need to update the exam. We'd like to continue to look at those regulations and maybe get some changes done. And Dr. Burkhart has agreed to kind of chair that committee for the board for education. And since we don't necessarily want to make that another public meeting, we will be looking at task force members that were involved that are not part of the current board and committee, but are involved in mental health across the state. So I think that's probably the big thing there. Other than that, unless there are any questions, that would conclude my report.
Thanks, Janelle.
Thank you, Madam President, members of the board. Okay, so my report is super short and sweet. How you guys like it? So the first chart that you're gonna see is just the new licenses that have been issued since the last board meeting. And then you're gonna have your renewal statistics, which I include every report. So the last meeting, I did include the chart to kind of show the differences from the types of licenses, what we're issuing. Our previous total has gone up. We are what I thought was very interesting, we are up on our multi-state licenses. We added 647. Also our nurse practitioners, we added 416. Which I thought was really promising, especially since we're already in December. So we're already 6 months out from our June, July class. So that's really good. And we're about to hit our December class. So hopefully we'll just continue to keep going up. So that's a good sign. Busy. Yay. So do you guys have any questions for me?
I had one comment about the multi-state. A lot of employers are requiring nurses to have multi-states.
Really?
Yes. And I don't know if that's up on the borders or what, but because they want them to be able to go within their entire facilities, areas. Yeah, it's becoming mandatory for nurses to have multi-states for some employees.
There was a very big push right after we implemented it, that even the nurses who were employed had a certain amount of time to convert. Like they needed to convert to keep their jobs because they could potentially be sent over to the state line. And so they had to have it. You know, they gave them like 60 or 90 days right after we had done it. They didn't have a choice. So, because yeah, I mean, the facilities needed to cover themselves, which makes sense. So.
That's an important consideration when there's disciplinary action and then we revoke the multi-state, that licensees know that maybe their employment is at greater risk if they're only a single state.
Absolutely.
Thank you, Brianna, and thank you, everyone, for the format. I think that's very helpful in including the strategic plan components that are addressed, so. So we will move to committee reports. We'll start with education, and I believe, Ruth, are you going to?
Yes, good morning, everyone. Madam Chair, I'm reporting off of the Education Committee. Amy Height is apparently not here with us yet. Our committee yesterday discussed several important items, and I'm going to read you our motions that were made. Motion number 1, it was moved to approve the consent item agenda, which includes the nursing education staff report, the 2025 site visit schedule, the petition summary 8/13/24 through 11/15/24, draft regulation review approval, KAR 60-17-101, 60-17-102, 60-17-103, 60-17-104, and 60-17-105, and I believe that concludes the regulation review. Now,
We did additional ones that did complete it, that will be approved the next night.
the second motion, it was moved to accept the site visit report with recommendation. I'm sorry, I apologize. One at a
We'll
time.
just take a second
Yes.
for that first motion,
Yes.
if we can.
Okay, I move to approve. Ask for a second.
So we have a motion and a second. Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion passes.
Okay, ready? That's fine. Thank you. Motion number 2 is moved to accept the site visit report with recommendations for Emporia State University BSN program and reapprove the program for the time period of national accreditation.
Sharp second.
Thank you. Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion passes.
Okay. Motion 3, it was moved to accept the site visit report with recommendations for Fort Scott Community College ADN program to remain on conditional approval to cease admissions to the program until all recommendations have been addressed and board has given approval and a site visit to be completed prior to approval to restart admissions.
Second, or is it? Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion.
Okay. The next motion, it was moved to accept the site visit report with recommendations for WSU Tech ADM program and to approve the program for 5 years.
Discussion. All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion carries.
Okay, the next one, it was moved to accept the initial site visit report for Southwestern College with approval to admit 20 students annually beginning fall 2025, with a site visit to be done after the first graduation.
Second, or Hazen? Discussion. All those in favor say yes.
Yes.
Opposed, no. Any exceptions? Motion carries.
It was moved to approve the major curriculum change request from Barton Community College to transition nurse 1207, mental health nursing 1, from face-to-face to an online format.
Motion, do you have a second?
A second. Here.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion carries.
The next one, it was moved to approve the major curriculum change request from the University of Kansas School of Nursing BSN program to change the current clinical hour calculation based on a 16-week semester to a 15-week semester calculation, with a change in clinical hours from 768 to 720.
Sharp second.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion carries.
Okay. Next, it was moved to approve the major curriculum change request from the University of St. Mary BSN program to change the delivery method of the NU AT in parentheses 101 drug calculations in nursing from online to hybrid delivery.
With a motion, is there a second? Second. Thank you. Any discussion?
And who was the second?
Thank you. All those in favor say yes.
Yes.
Opposed, no. Any abstentions? Motion carries.
It was moved to approve the major curriculum change request from the University of St. Mary graduate program to approve the new psych mental health nurse practitioner PHN-HNP certificate concentration at USM.
There's a second.
Second, or Hazen.
Discussion. All those in favor say yes.
Yes.
Opposed, no. Any abstentions? Motion carries.
Next. It was moved to approve the major curriculum change request from Mid-America Nazarene University School of Nursing BSN program to add an 18-month ABSN hybrid cohort, 25 seats, along with the current ABSN and traditional BSN tracks. Overall number of approved seats for the BSN program is not changing.
Is there a second? I'll second. Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Motion carries.
It was moved to approve the major curriculum change request for Mid-America Nazarene University School of Nursing graduate program to close the AGP CNP program due to insufficient enrollment.
There's a second.
Second, or Hazen.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion carries.
Next, it was moved to accept the initial application from Chamberlain University for a new pre-licensure BSN program in Overland Park, Kansas, with a site visit to be done prior to approval to admit students.
Sharp second.
Thank you. Any discussion? All those in favor say yes. Anyone opposed, no. Any abstentions? Motion carries.
Next, it was moved to reapprove the PM programs on full approval status through December 2025.
Carried. Second. Discussion. All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion carries.
Okay, next, it was moved to reapprove the ADM programs on full approval status through December 2025.
Second. Discussion. All those in favor say yes.
Yes.
Yes. Anyone opposed, no. Any extensions? Motion carries.
Next, it was moved to reapprove the BSN programs on full approval status through December 2025.
Sharp, second.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion carries.
It was moved to reapprove the 1 PN program, Mid-America College of Health Sciences, and the 3 ADN programs, Donnelly College, Fort Scott Community College, and Seward County Community College, on conditional approval status through December 2025.
Second, more Mesa.
No discussion. All those in favor say yes.
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 Anyone opposed, no. Any abstentions? Motion carries.
It was moved to reapprove the programs on initial approval status through December 2025, which include Allied Health Career Training, Galen College ADN, Barclay College BSN, and Ottawa University BSN.
Motion for a second.
Second.
Any discussion? All those in favor say yes.
Yeah.
Anyone opposed, no. Any abstentions? Motion carries.
Thank you. That concludes the report.
I wish you all had some things to discuss, but you. Okay, we will move to the investigative committee and Juliana is absent, so Adri, give the report.
Yes, and thank you, Linda, for assisting with that. Our investigators, as always, have been very busy and did an amazing job. The investigation committee reviewed 85 cases. I won't tell you the number of pages that. We've asked Linda to look at other state board of nursing to look at the processes as to how to work complaint cases to streamline the efficiency. She's going to look at a lot of different things, continue developing on the sanctions reference, guide to a template to ensure consistency in the disciplinary action. That's a really big thing that we're looking at. Had a lot of good feedback on that. See options for summary format from other state board of nursing to make it a little easier to get the meat and potatoes. The risk managers at facilities who report may not participate timely in the production of the documents requested by the subpoena. We've run into that, which causes it to look like we've been sitting on that. So we're working on avenues to consider for reaching out to the facility support system to see if we can facilitate that. Tremendous progress was made by the committee to close out older cases and clear out backlog. And our attorneys have been working really hard on that. Sydney's brought some new ideas to the table, which I think will help us tremendously. But we had a long, busy day.
Can I just ask a question in general, that's not even from this, so if a complaint is made and it's an identified person complaint, that goes to that case, if you will be looked into, and then it doesn't necessarily become, after an investigator reviews it, it doesn't necessarily move on to be an open case, if you will, but any formal complaint that's made has to be reviewed in some way. Is that correct? And so then it just trickles down from there to where it goes to the investigative committee on or through the process.
Yeah, all complaints that were received are reviewed.
Some of the documentation they have to do for in other areas, not just facilities, but, you know, any area that would have records like the police department or any of that. They really have worked very hard to get that. And in some cases, it has been a struggle to get records. The older they are, the harder it is. So they've been working really hard to get them to us, and we're hoping to streamline things even more.
I would just add, I can't really emphasize enough how important it is that we have adequate assistant AG support. If we have reviewed a case at a prior meeting and done a revocation, and because of due process, the AG is not able to get through that, it's possible that we can see another case at a next meeting, and that the licensee is not even aware yet that they are in a process of revocation, because there hasn't been an opportunity to clear off some of that backlog. So we would love more applications for that other part-time position. We're really glad to have Sydney on, but I want to make the board aware that that presents a risk to us if we are not able to process those, especially revocations in a timely manner.
And as you can see, it's definitely a group effort with the investigation community.
I know you all always have a busy full Monday. So.
We also,
And you're
I forgot to mention, but we also have a full-time RN investigator position open also, and it's posted, so I do have an interview next week, so I'm hopeful.
Yes, and we're gonna miss her.
Yeah, we'll miss one, yeah.
I have a quick question about the risk management. Is that elevated anywhere within those healthcare facilities? As in not getting information in a timely manner?
Well, that was one thing that Juliana stressed, that she thought it might be a good idea at this point for her as head of the investigative committee, or possibly our chair, to notify the heads of some of these facilities that we are not getting
At
the
least the
document, we're not getting the documentation that we need.
Whether it's from risk management people who are. Here's the complaint, that's all you get.
Sometimes it's very clear that the CEOs and managers are absolutely also involved and aware, but not complying.
Okay.
And sometimes these facilities have closed in the interim, and that's really presenting some challenges.
So is there a clear hierarchy of who information is communicated with a facility, or is it just dependent on what it varies and everything?
It varies. Usually we communicate with the risk manager or whoever submitted the complaint at the facility, if it's a long-term care facility. Usually it's the DON or the administrator. But like those facilities, they could have a parent company that houses all of the records, and that could be out of state. So it takes a while to get records in sometimes. Some of the risk managers who filed complaints are the ones who are also not responding to the subpoenas. And so then we have a mechanism to where we can like now send a letter or something to their supervisor to see if we can't get that trickle down effect, to let them know that we're not getting timely response. So it's a process that we're trying to work through, so.
We
can get
discovered a way to
timely
give her
evidence.
more work.
We get more work.
We did, because when a complaint's made against one, but there were other participants in the investigation that you're like, wait a minute. We need to look into their part of it too. So we found more work for them.
Thank you. For CNE IV therapy, I'm going to hand the meeting over to Kayla. Thank you very much. Just to report that we did not have a quorum. So that was unfortunate. But I would like to ask, we did have one 5-year renewal application, and that applicant approval will expire before our March meeting. And so I would like to move that we can extend that approval out until after that institution can be reviewed at the March meeting, because it's not fair issue, everything was returned, as required for that review. We just weren't able to review. So I would make the motion that we can extend that approval for. It was. You have that girl, right?
I believe it was professional continuing education.
Yes. Thank you.
So I second.
Yeah. Is there any discussion? I just had a quick question. There's been no problem with that in the past, correct?
Correct.
I'm sorry, I couldn't hear.
There's been no problem with with this organization providing CDs in the past. There's never been an issue. That's my question. Yeah. And so would all those in favor signify by saying yes?
Yes.
Yes.
Are there any opposed? Are there any abstentions? Motion carries.
So all of our agenda items will move to March. We'll pick up from there. Thank you.
I'll pass the meeting back over to you.
Melissa.
Oh, okay. Thank you, Madam President. We did have a quorum. I did run into that before. So we had some consent agenda items. I'm gonna go through a couple things that we did in the meeting and then I'll do my motion at the end. So we're here shortly. We'll be updating the APRN hours for education up to 7:50. There's no grace period. We are going to update the website, try to get the word out. So when people go to potentially states or schools out of the state of Kansas, that they'll know what the new requirements are as per regulations. So that was one. The other one is we now have a new K-Trax member who will be updating us as they're meeting. There's only one meeting with no update, but that's Tracy Clark, and she'll be joining us for our meetings, and we're very happy to have her. An update on the CNM regulations. There's still 2 left, but we now, I believe, have the full 4 reps. Now that's it with the Board of Nursing, or we're up to about 3, and then the other one should be added here shortly. To see if we can't get those completed as well. The last thing was the new business. We were asked to look into continuing education for nurse midwives and making that a little clearer. So we decided we were going to look into that for all of the nursing practices to make sure that's as clear as possible. So it goes through the process over the next year. And we're doing the right thing for everybody who works in the state of Kansas to get their educational hours. So we'll be doing that as well, and we're gonna follow up on that on March. And then I do have my motion, which is, I move to approve the consent item agenda, which included APR programs approved for licensure, a final review for APR, all 4 goals, KER 6011-113, 60-11-116, 60-11-118, 60-11-120, 60-11-121, the nurse practitioner KAR 60-11-104, and KAR 60-11-104A, and then nurse midwife KAR 60-11-105, and clinical nurse specialist KAR 60-11-107.
We have a motion. Is there a second?
Second.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed? No. Any abstentions? Motion carries.
So can I also just point out, I have discussed that with Carol as well, and I think we're going to actually, because that is changing for the APRN hours, we are going to incorporate that into the application as well. Like put that in as a question so that they have to have that. They know they have to have that. So we're going to put it on the website and the instructions and on the application.
Oh, nice.
So that they know what they are getting into.
It's a great idea.
Oh, that's a
Okay?
wonderful idea.
Thank you.
Where it's gonna be everywhere.
I think it affects a lot of the committees.
It really, it does, and so that way, when they apply, like not only should have seen it on the website, if they are looking at what they are applying for, but they should definitely see it when they have to answer, yes, I have this, or, because the certification and the malpractice insurance that's out there. It's a question on there. They have to, I mean, they skip it, but it's out there. So, I have already talked to Carol about that because, you know, they're gonna have to tell us that their program, they're gonna have to tell us that they have those hours. You know, they should know that as well. So we're gonna make them do a little bit.
So will that be a hard stop that they will have to answer that question?
That I don't know.
Right now, we can't do it, right? So,
Okay, so because we allow them to skip the med mal and stuff. Right? So, okay,
We're gonna figure it out.
okay, all right.
Can I ask, how do our hours compare to other states that would just change?
With 750, there are quite a few outstate,
There's gonna-
educational facilities that were like 689, 660.
especially if they
100
have a
hours.
master's instead of a doctorate. The doctorate is typically not a problem, but some of the masters, it's gonna be a problem, especially maybe if it's been a few years. I think we're seeing more and more come up to 750, but there's still, you know, applicants who graduated a while ago or something. So it's gonna hit some of them, but I think 750 is seen a lot more across the nation. Yeah, I don't think we're going out there all on our own and stuff like that.
All of our, I would say all of our DMP programs are over 1,000. Are really close, but, the role of the nurse practitioner where I work has expanded. We have more of them covering patient care. So their continuing education is very beneficial, you know, in areas that they might not be as used to because their roles are becoming more the leading force in primary care. With the MDs doing more of the administrative type things.
What would the option be for someone who's short? Like what?
Well, an option would be that they go back and get more clinical hours.
And they would just have to.
They'd have to find a program that would let them do that. Right now, they have to have 45 credit hours, and we run into some that do not
Several.
have 45, they may have 42, 43, and their option is to find a program and take another course that will get them up to 45. Some of them do that.
There's a solution, right?
And then they're probably not gonna like it.
They don't like it, but.
There's a solution.
But the other thing too is a lot of them have done, because we do offer, you know, if they've taken a graduate nursing class from any other institution, they just have to send us the transcript. And, you know, we'll add it.
Yeah.
So a lot of them have done that, but some of them, especially like a big one that we have ran into is, University of Central Missouri is 44 credit hours. And they're actually reworking the program to be 45 because they just, you know, they don't meet the requirement. So, I mean, we do offer, and we tell them, and that's all over the website also. Right there that it says.
I do a lot of, response to requests because of the U.S. Department of Education requirement on, you know, making sure that if you're accepting students from other states, that they meet the requirements for their licensure if they're going to be in that state. So I have programs that continue, even though it's on the website, and NCSBN also has those from us. They have them on their website for everybody, but to remind them what our curriculum requirements are. And a lot of them this year, I've told them that we're in the process of changing. So a lot of them are aware, and it's not there yet, but it's once that approval is done, that number will go up because I've seen it as still as low as 645. I think is probably the lowest I've seen. But again, MSN programs are still out there. There's only a handful of states that require the DMP for advanced practice. So until that starts happening more too, it's probably.
I don't know that a lot of them are that surprised either, because especially since we're the full practice authority now, so I think a lot of them are, you know, expecting the changes to come down because of that, so. So yes, I just wanted to let you guys know we are gonna incorporate that in the application. It will see it in several places. they will have the opportunity to reach out and ask questions if they need to.
And they'll be able to monitor the impact on the number of licensees, licensees as a result of this change.
Yeah. You have to remember also, I think that when the law passed 2 years ago for full practice authority, we do not have practice hours. They need practice hours after they graduate. So they can graduate from a program and have full practice right away. Some other states have put, like, they have to have a certain number of practice hours. They could get licensed, but they would have to work underneath supervision until they got those practice hours in, and then they could be moved to full practice without supervision. Kansas does not have that. So, I think the clinical hours are very, very important because we're not going to require them to have any more once they graduate to do full practice authority.
Makes sense.
Thank you. Practice committee, sorry, Lori's not here. I didn't speak all of it. Thank you.
Yes, thank you. We had a very busy but efficient meeting yesterday. I have 3 motions, but before I do that, we are almost through all 27 of our regulations. We'll get 4 of them for approval today, and then March, we will conclude with those. Carol's done a lot of work on revising 60-7-105, the standards of practice regarding LMHT. And she's keeping us compliant and in line with what we need to do to satisfy the regulations from a legislative perspective. One of the bigger things that we discussed yesterday, and guys, please keep me honest as I relay this. So it was brought to the board a fatality with a certified professional midwife involved. And so as the board, since that it's a non-nurse entity, we're figuring out how to address that, which jurisdiction. And so Linda is going to be reaching out to somebody in that organization in the state of Kansas, and we're going to seek to understand and decide what we need to do next in that perspective. With that, I have 3 motions for us. First is a consent agenda item. It was moved to approve the consent item agenda, which included practice calls report. I'll second. Or Hazel.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed? No. Any abstentions? Motion carries.
It was moved after regulation review to approve the following: KAR 60-15-101 definitions and intentions, 60-15-102 delegation procedures, 60-15-103 supervision of delegated tasks, 60-15-104 medication administration in school.
Motion's there, second.
I'll second Burkhart.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed? No. Any abstentions? Motion carries.
And then our last item, it was moved to approve KAR 60-7-105 as written.
You have a second?
Second, or Beza.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed? No. Any abstentions? Motion carries.
This kind of thing, it's just the right amount for your voice.
I know. Okay, I will hand the meeting over to Michaela for Finance Committee report. Thank you. We reviewed upcoming motions today. We reviewed the fiscal year budget for 25 through 27 that is being proposed. And we're in discussion about changing the name of the Finance Committee to encompass not only finance, but also risk management items, including cybersecurity. So there'll be more to come after the March meeting, most likely. And maybe back over to you. You. So. Break for anyone before we move to unfinished business or. Okay. Unfinished business, regulation review status update.
Yeah, on page 16 in your packet, if you remember this regulation review progress that you've all been working on, I really appreciate that. This came out of legislation that requires agencies to review all of their regulations and answer some questions about whether it could be revoked and how does it contribute to, you know, like patient safety and things like that. So the report that I have to submit is going to be July of 2025. That's why we're really pushing all these committees to get these reviewed. So each committee, all of our regulations, which is probably about 90, were divided among the committees that it was most applicable. And then it was up to them to decide how to go through all of these so that they would be done. And what you have, everything that's in yellow has already been all the way through the approval process. So you can see that's a lot. The ones that are shaded in gray, probably the ones that you heard in these motions that are final approval that you just did. So the only ones that were still out there are the ones in white. And a lot of those were discussed yesterday for the first time around. So then the final would probably be done in March. I told them they had to have these done by June, so it looks like we're going to make that. So that's great. I don't believe at this point in time that I've heard that any of them could be revoked or that they feel that they could be revoked. So anyway, that's where we're at with that.
Kudos to all the committees for pushing those on through. The KSBN newsletter, report strategic.
Yeah, Madam President, board members, Adrian and I have been looking at vendors that could take over our quarterly newsletter and also do our annual report and our strategic plan. If you remember right, the vendor that we had for quite a number of years went out of business. So they kind of turned a lot of stuff over to a vendor called Nursing Network. And so I have information about that one, and I have information from Publishing Concepts. They're another vendor. What I did is just kind of compare the two on different things. So I'll just kind of go through that and tell you about the differences, and then hopefully you can decide which one you would like us to go with. As far as cost to KSBN, Publishing Concepts, there's no cost. Nursing Network, the cost would be to distribute the newsletter via print until the vendor has that option. So what that means is that option with that vendor is only for electronic. If you wanted anything paper, it would be at the cost to KSBN. We would get like a file and then we can have it printed someplace or do something like that. So if you wanted to do that right now, our newsletter, we do not. However, our annual report and our strategic plan, we have printed copies. So just gotta remember that. Advertising, Publishing Concepts, the vendor will handle all the advertising. And Nursing Network, they will also handle all the advertising. Approval, Publishing Concepts, all content and advertising will be approved by KSBN prior to printing. Nursing Network, the content will be approved by KSBN prior to publishing. The vendor and KSBN will have the right of refusal on all ads within the newsletter. KSBN may provide Nursing Network with a list of advertisers they consider offensive or controversial. And then Nursing Network will have the sole exclusion right to publish, distribute, and sell advertising in our newsletter. As far as print versus electronic, There's some differences here, probably the biggest difference that you will see. Nursing Network only does electronic distribution. And so it would be like on our website, we can push it out and stuff like that, but it truly would just be electronic. However, again, KSBN at KSBN's cost could have some printed. Now, Publishing Concepts, they have both electronic and print. They actually print quarterly on gloss text in a magazine format, just like this. This is from another board of nursing, is what it is. And how they do this, how they deliver this is really kind of interesting. They deliver it, the paper copies, via three-pronged approach. Individual printed copies can be mailed to employers, etc., within the state, if KSBN wants that. We would supply addresses to be included on that individual mailing list, and then they would take care of it. Printed supplies of the printed newsletter are shrink wrapped in bundles ranging from 5, 10, 20, and 40 copies, depending on the number of nurses and the mail stops within each place of employment that we would send. So these would actually be, if we wanted them to go to a certain employer or several employers or whatever, they would send enough copies of this to put them in break rooms, different stuff like that, because having them electronic the way we do now, we hear nurses don't really look at that, although we have a really good click rate on our newsletter, but that would be a big difference here between the two. All the advertising and everything is in here. Again, there's several boards of nursing that use this vendor. And then the annual report in the strategic plan, the Nursing Network would have electronic copies of it. The Publishing Concepts, again, will have printed and electronic copies of these, and they will print the number that we request. If we want 100 of them to give out to certain people or something along that line, they will print those if we tell them, and they'll look very similar to this kind of format. Delivering the content for Nursing Network, there's going to be a template for the newsletter that will be developed for KSBN, and then KSBN staff will input the content into this template for the newsletter versus the vendor inputting the content. And that's different than how we did it electronic with our other vendor. We would send them the content and kind of tell them how we would like it arranged, and they would actually put it together for us. Now, Publishing Concepts, a staff member will collect all the content for the newsletter each quarter and email that content to the vendor. The vendor will format the content and then send a draft back to KSBN to approve. So that's pretty similar to how we're doing it, how we were doing it. Frequency, both of them will do quarterly newsletter. For Nursing Network, I don't know that we have as much choice over when those quarters are, because what we ran into with the other one is the information that staff provides that hit very shortly after committee and board meetings. And we already have a lot on our plate trying to finish up, and we had to make sure that we had articles ready to send. So the timing wasn't exactly the best, but Publishing Concepts will, we can decide the quarter schedule. It will be a quarterly newsletter, but KSBN can decide what those quarters are going to look like. And then they'll do the annual report and the strategic plan annually for both of them. The length of agreement for Nursing Network, it would be a 2-year term. Either party can terminate the agreement with a 180-day notice for the lack of performance. The other one, I don't know. We haven't really talked too much about the length of agreement, but that is the choices that we wanted to bring to the board for you to tell us what you want done. I don't know that there's a whole, I don't know that there's a whole lot else out there as far as vendors. So this is probably the two that we have to choose from.
I have a question. Did I hear correctly that they choose the advertising? I guess it was nursing.
Nursing Network, they will have, what KSBN can do is supply a list to them of advertisers that KSBN considers offensive or controversial.
Oh, okay, okay.
Yeah, so if there's a certain advertiser that we would not want to have in our newsletter, we could tell them that. But other than that, they pretty well take care of the advertising.
Okay.
That's what makes the money on this is the advertising.
Oh. I heard you say that there aren't necessarily print options clear for Nursing Network versus that there are for Publishing Concepts. Also, it seems like another key piece is the staff time required in putting in information if you utilize Nursing Network versus utilization of Publishing Concepts. So as I heard kind of the comparison to me, that would be also be a key piece to keep in mind to think about what vendor you want to go with.
The other, Madam President, the PC.
Publishing Concepts.
They,
That's this one.
do a lot of other boards of nursing's work, so they're familiar with our industry, so to speak. And they do attend, some of the NCSB meetings. They usually have like a little booth and those sorts of things out, so they're familiar with kind of the discussions that we all have.
And they're also, I think, very helpful if they know that NCSBN has put out something that's been in other nursing newsletters that would probably be applicable to Kansas nurses too. They can share that with us. Again, we have the choice whether it goes in there or not. But typically, if it's for one board of nursing, it's for most of them. You know, whether it's like social media or I don't know, you know, that's just different ones, but
Just in going to the schools of nursing and doing presentations, there isn't really a means to be able currently with the previous newsletter, because it was emailed to licensees. Well, the students are not licensed nurses. So this is the one that would be able to be shrink wrapped and sent.
And sent
perhaps
to
the
schools of nursing, yeah.
And we could have a page specific to students, you know, and what they maybe need to consider, especially if they're looking to see the APRN changes for the clinical hours, or that's my thinking, just from what I've been seeing, so.
Yeah, they'll send these shrink wrap packets to whomever we ask, you know, employers, schools, whatever.
And I believe we can actually, provide the list of licensed individuals, at least currently, that's how we did it. But like Linda said, you know, if she could do those presentations or something, I believe there's a link that they can actually subscribe, even if you're non-licensed individuals. I mean, you'd have to be proactive and do it because we don't know about you until you're here, but we could put that on the website and social media. Like during presentations, they could share that and, you know, highly encourage them to go ahead and start following it. It'll be online as well, so.
Well, it goes aligned with the strategic plan, like the first. Shrink wrap, that's what I mean.
And can I ensure that in the contract that there's language that they don't provide the mailing list to the advertisers? That this is just for the purposes of distribution, but they're not taking that data and then selling it to other vendors.
And we brought that up in the conversations, but yeah, obviously we want to make it official. That we retain the rights for that based upon the open records laws. There is a special exemption that allows us to protect that particular portion.
The additional printing, is that something we've accounted for in the budget? I mean, something that's going to cost.
Publishing Concepts.
Yeah, Publishing Concepts, there would be no charge. The other one, if we wanted to print some, it would be at our cost, and I don't know what that would be. And I don't, right now, we don't really print any. because we did they did the annual report, but then they would send it to us and we printed it. It was available on our website. Same thing with the strategic plan. But we don't typically circulate a lot of those, so it would kind of depend on how many you wanted printed and, you know, if we could go through our print thing, or we haven't really went down that path, but.
We started looking with the state printer. That was one of the options that we thought we might have to produce our own. I mean, that was one of the things that was maybe on the table, and we started talking to them about what the cost might be if the agency were to incur it. But it became so we didn't get into the weeds when we found out about these other options. So if that is something you'd like us to explore, we can do that.
So just to clarify, so no cost to send it to to send it the shrink wrap version, but it would cost just to do the strategic plan and.
No,
So it's
there
still-
would be no cost for those either, yeah.
Madam Chair, I would move that management be requested to engage in a contract with Publishing Concepts to produce the board's newsletter, strategic plan, and annual report.
Yeah, we have a motion. Is there a second?
I'll second it. I think it's good.
Any discussion? All those in favor say yes.
Yes.
Any opposed, no. Any abstentions, motion carries.
Madam Chair, I have to excuse myself for about an hour to attend a meeting across the street.
If you'd like, you can use the room that we were in this morning.
Yeah, I think-
Oh, we got those.
I actually need a motion written out on that.
Oh, okay. Can you just sign that?
Yeah.
Sign that real quick and then we praise that.
I'll write it out.
Yes, just sign it, I'll write it.
Thank you.
We'll move on in unfinished business, types of nurse midwives.
Can I just ask a question? Charles and I, Melissa, did you do the motion coming out of APRN? Did I
did.
miss that? Oh, okay, all right. We were evidently not paying. very good attention.
I did the consent.
Right, okay, great. We just didn't catch it, so sorry about that. Charles and I obviously need to pay more attention there, so. Types of nurse midwives, I think maybe Linda's the one who's gonna find out, because they talked about this in practice.
Yeah, I think it was brought up in September's board meeting from the investigative committee. And so it was asked that practice would look at this, to start looking at this, to make recommendations back to the board. And so practice met yesterday, and as Michelle indicated, we did have some discussion, and so we're gonna move to see if we can get, there is a state agency or state association apparently for them, so we're gonna see if maybe there can be a representative from that state association come to our March practice committee meeting and provide education as to this role and, you know, maybe give us better guidance as far as like where we need to go next, and then being able to make recommendations back to the board. So we're starting with just kind of becoming educated as to who they are. But that we are seeing them practicing in the state of Kansas, so. And I did include the chart that I gave to the practice committee as this is developed by the American College of Nurse Midwives to kind of give an overview of them. So I did include that in your packet, so. And if anybody wants to attend virtual on the practice committee or in person, you're welcome to kind of listen in, so. To that education piece.
And you're saying that you're seeing more of the certified professional midwives.
They're being reported, which is what, you know, raised the question, who are they? Because some of them have an RN, some of them have a CNM and a CPM, and some of them are just CPMs. And so there is no oversight of the CPM currently in the state of Kansas. There is some states who have some licensing of the CPMs, and that's kind of, I guess, I think I was asked to bring some of that back too in March. If I can get some research from that to kind of see where we compare to other state boards of nursing. yeah, it's just the beginning stages of kind of trying to figure out who they are. But we're getting reports of complaints of unprofessional conduct, and does the board, does the investigative committee even have authority, jurisdiction? If they have an RN, but then what does the board do? Yeah, so there's questions.
More questions than answers at this point.
Right. Well, thank you for looking at gather information, conversation. So I know that we have scheduled time. Do we need to sort of change the order of our new business?
Yeah, leading age is actually scheduled to come at 12:30, right after lunch.
And then we have some scheduled time for one of our executive sessions at 1:00.
Mhm.
I'm wondering, do we have time that we could move to our first executive session?
Yeah. If that's what you want, yeah.
Mhm.
We have the number.
Yes, I do.
Let me get the right one here. Who wants to read this? I'll pass it down. Somebody
There you
can
go.
stop and read it.
I'll be glad to read it.
You just have to decide how long you want.
Do you want me to read the whole thing, I'm assuming? Okay, it's this, do you want
Think if
me to
we,
pass it to you? I'm going to see.
if we have minutes. I think it'll be okay.
Oh,
Okay,
yeah, that's good.
are you ready then?
Yes.
You ready? I'll go ahead and read this. Pursuant to KSA, excuse me, 75-4319B1, I move that the board recess into executive session for 20 minutes and reconvene at 11:15 a.m. The meeting will be reconvened by Zoom and in room 509 Landon State Office Building, 900 Southwest Jackson, Topeka, Kansas, 66612. As stated in the notice of the meeting that was sent to individuals who requested the notice and as published on the board's website at https://ksbn.kansas.gov/. The justification is to discuss personnel matters of non-elected personnel. The subject matter to be discussed in the executive session concerns an employee performance evaluation. To aid the board in its discussion, Adrian Guerrero will join the executive session.
Thank you. So I would ask that board members bring the packet that was shared with you this morning. And then just a reminder to sign out, but clear that. Okay, I'm sorry. Do you have a
I'll second.
motion? Thank you. Any discussion? All those in favor say yes.
Yes.
Anyone opposed? No. Any abstentions? Motion carries.
Be back in a bit.
Okay. Thank you. We're back in session. We'll start with the announcement from Adrian first.
Okay. Thank you, Madam President. Just a small little update. We are working on dates for the strategic planning session. If, as long as the contract and everything goes through, it's gonna be April 22nd and 23rd in Wichita. And we will get all the details once we get the final approval through procurement and everything, but we do have the same facilitator, Dr. Stephanie Ferguson, is gonna come back and join us, so that'll be a good continuity of the discussions that we've laid out last year. And we'll be working with her over the next few months to get that ready. And then have the session done. And we'll work through the logistics and everything once we get all that going, but.
And that was April the 22nd.
Correct.
The 23rd, okay, I got it.
And we'll do similar as we've done in years past where, you know, it allows a little time to get there and then you'll have the, basically the one overnight time from the 22nd to 23rd and then departure midday somewhere.
Yeah, the only question I had is what do you want from the staff as far as the current strategic plan that we would be finishing up? I mean, we can put down everything that we've done that we know or we can think of on it. Is there something else that you want? Because it would be time to finish that one out and start a new one.
Linda, would that be too soon to go over anything you found that the investigation committee has brought up? Would that be an appropriate venue for that?
As far as what,
How the other boards are doing something?
how the other boards are doing stuff in relation to our processes.
Right. And getting the caseloads completed.
So how does that operations, how does that reflect in the strategic plan, I guess?
I don't know, that's what I.
Yeah, or it may be on the new one that you put together,
Okay.
that starts in 2025.
Okay.
Because they worked on that some with Stephanie last time. She kind of looked at our present one and said, you know, what she thought could come off and stuff like that.
I know we're looking at how to streamline some of them so that it doesn't have to wait till the big meeting.
Yeah.
To be able to, and more consistency across the board.
Well, it seems like if that was some discussion at the last meeting in terms of ideas of how to move forward for the next strategic plan. Just, I think bringing kind of the wrap up pieces from that meeting to help us move forward. And then like all the work so far from the prior plan, because those would be part of what we would then review to see what has been accomplished on our prior plan. Is there anything that needs to carry forward? And then taking into consideration those ideas or thoughts on how to change or streamline any of the pieces for the next. I don't know that it seems like maybe what you're asking, Adri, might be something that would come out of our discussion. That would be part of the next plan. Okay. I think what you kind of did, in my opinion. Anyone have anything to add? Well, thank you for working in advance to try to finalize the time and completion and all those things so that everyone can get that on our calendars to plan for that.
Absolutely.
We will move to review of KR 60-3-114 approval. Yeah, Carol, do you have
Thank you. If on page 29 in your board packet is the revision that you wanted me to send through the approval process for KAR 60-3-114, has to do with the refresher courses. If you remember, you decreased the number of clinical hours for both the RN and the LPN. and allowed them to have it like in the setting of their choice, some of it in the setting of their choice. So this has been all the way through. The 60-day public comment period ended. It was presented to the Joint Committee on Administrative Rules and Regs during that 60-day. And then their report is here. I received no comments at the public hearing, and I received no comments, just written comments or anything during that 60-day comment period. But you will see when I took it to JCAR, they had some really good questions. For some reason it's not loading. Because I also took the APRN education regs at the same time. They wanted me to do that since they were meeting. They had, I think, a lot of very good questions. You know, have to remember that they don't really always know a lot about nursing, but they seemed engaged to ask some really good questions. So the only step left in this, you see that they really had no comments in the minutes that for some reason are not loading. Anyway, so the next step is for you all to decide whether you want to approve it now that it's went all the way through, or if you see other changes that you would like to make. If you make changes, it starts back through the whole process again. I just want to make you aware. If you feel like you're ready to vote on approval or something, or whenever you are, we have to do a roll call vote. So you have questions or what you want to do?
Anyone have further questions? Okay. I mean, I think that this has been reviewed, amended, and went through the process. So I would propose that we move forward with a roll call vote. Did we- Yes.
Okay, I move that the board adopt KAR 60-3-114 and that a vote be taken by roll call vote.
You have a motion, is there a second?
Second.
Thank you. Any discussion? All those in favor say yes.
Yes.
Anyone opposed? No. Any abstentions? Motion passes.
Okay, and then I'm gonna read your name. You just need to answer yes or no. Andrea,
Yes.
Michaela,
Yes.
Michelle,
Yes.
Audrey,
Yes.
Ruth,
Yes.
Melissa,
Yes.
is Amy on?
Yes.
And Brenda's out. So we have 7 yeses and 0 no's.
Yeah, no. Okay, thank you.
Thank you.
The next steps, just to let you know, I have to send something to Division of Budget, just paper about this public, where you guys did it at a public meeting and all of that. And then I submit all of that information to the Kansas Register. It has to be published in the Kansas Register, which, as short as this one is, it probably will get in pretty soon after I take it over. And then it actually becomes effective 15 days after the publication date. And then we'll put some information on our website. We'll change the information that we have on our website about refresher courses. And Chanel will communicate to the people who do refresher courses. And then we can put it in the newsletter too, when we get that. So that's probably the communication we'll use.
Thank you. So I think the other items are scheduled for discussion after lunch, after 12:30 or later. So break for lunch.
Yep, it's ready. Upstairs. Yeah, it's ready. Are you ready for the break? Okay, sorry. We'll be back, in a little, what, 12:30?
Yeah.
Thank you.
Thank you. So we're gonna pick back up with new business. And, we are going to move forward with leading age discussion. We have, someone here today. I'm sorry, I did not get your name. So
I'm Kylie Childs. I'm the Director of Government Affairs with Leading Age Kansas.
great. Thanks, Kylie. So, if you want to provide just kind of an overview of, leading age and what you're preparing to or intending to present to maybe the Kansas legislature, or what sort of feedback you want from the board today, that would be great.
Okay. So Leading Age Kansas is a nonprofit state association of nonprofit and mission driven. So we have providers across the full continuum, everything from home care and hospice to your state licensed only residential health care, assisted living, nursing homes, PACE. So we have a little bit of everything in our membership. And one of the things that we've really been trying to tackle over the last few years that was exacerbated by the pandemic was our nursing workforce pipeline. It kind of came to an emergency situation when trying to figure out what we're going to do with the federally proposed and finalized minimum staffing rule, and trying to make sure that we were going to be able to meet those thresholds of 24/7 RN coverage per day at each facility, as well as the 0.45 CNA hours per resident day and the 0.45 RN hours per resident day, 0.55, 2.45 CNA hours. They've changed them a lot. Total is 3.48 hours. That's something that we were in a disagreement with CMS about, just because we do feel like there is a workforce pipeline issue that we need to address first before we start putting in regulations that could be detrimental and lead to more closures. We have a situation report on our website that shows there were 47 closures or facilities that reduced capacity since the pandemic started. And we're just trying to prevent more of that so that we do not create further care deserts across the state. And so this next year, when we're coming back up to the legislature, our focus is going to be workforce. How do we start looking at different policies and regulations that maybe have not been addressed for quite some time? How we can create some flexibilities to allow people to stay in the workforce while they're upskilling, or bring new people to be interested into the workforce as a whole. And so one of the things that our membership, along with the different colleges that we've spoken to, have discussed is modifying the regulation that specifies what degree level that nurses need to have to be able to teach licensed practical nursing programs and the registered nurse programs. One of the things with the registered nurse programs is there is no differentiation between the associate's degree of nursing and the bachelor's of science of nursing. So currently, community colleges are still needing a higher and master's degree level faculty member. And when we're talking about Western Kansas and trying to further our pipeline out there, that can be difficult. And so one of the things we're looking at is trying to align with the Kansas Board of Regents rules and regulations 88-28-2. And that A17 just says each faculty member's minimum academic credential shall be at least one degree level above the degree being taught. And that's all we're looking to align when it comes to the Nurse Practice Act as well. So I'll start with that one. And if you guys have questions, if not, then I can move on to the next thing that we're looking at. Okay.
Thanks. I have a question, Madam Chair. But that first, the Board of Regents, what does that currently apply to? Is it with healthcare? Is it with psychology degrees? Is it with what kind of educational degrees?
It is just the minimum for all of their educational programs.
All undergrad. All undergrad. Okay. Another question? My next question would be, what colleges did you talk to?
We talked to the community colleges and
Which
the
ones?
Association of Community Colleges specifically.
Specifically, which ones?
The association.
The
Is-
Association of
yeah,
Community
so we
Colleges.
just talked with their
Kansas?
director. It would be Heather Morgan that we talked to. So she consulted with her members after we consulted with ours.
And she's the current head of the Association of Community Colleges of Kansas.
Yes. I believe that's the title.
She needs a residence. I can't hear what.
She needs it.
I think she meets with college presidents.
So asking for a difference of the degree of the educators for an associate's versus a bachelor's program. Even though those graduates of either of those programs take the same NCLEX test. So is there rationale for why the education expectations or level of educator should be different?
I think for us, we're looking at, how do we open those classrooms in terms of the pipeline level? And so if we're trying to bring in more faculty instructors in some of these areas that may not be as populated, and you're limited in the pool of people that may have a master's degree, but you may have somebody that has a bachelor's degree. And so we're looking at how can we allow them to step in and still have, we're willing to have other parameters set around it that, you know, you just earned your bachelor's degree and you go into teaching. If there needs to be some other parameters set around it that you have so many years of experience before you could then begin teaching, we would understand that as well. But we're wanting to make sure that we're opening those classroom pipelines in that one.
And do we have some, I'll ask you, Janelle, for clarification, but in our current requirements, do we allow for some leeway if people have a degree plan in place?
Yes, our current regulation states that an MSN is required if they're in charge of a theory course. It goes on to state that if they're hired to teach a clinical course, they can have either the master's degree or be on a degree plan, be a BSN with a degree plan. If a college cannot find, or if an administrator cannot find either one of those things and has gone through all their options, we do have the hire exception rule that allows them to hire, and they need to say how they're experientially qualified, educationally qualified, why they would put them in that role. But other than defining that out, they have the option to do that already.
There is some of that in place with some guidelines and some expectations for the information that's provided. But it's without it being just a blanket rule, which sounds like you're just asking for a blanket without specific guidelines in place for those. What the eligibility criteria would be for that position.
Yeah, we're looking that it's standardized and, like I said, matching up with the Kansas Board of Regents, but then each college gets to decide then, you know, if they still want to continue hiring master's degrees, they could choose to do that.
Did you have a clarifying point to know?
Not for that. So.
Okay.
So with what you have, there's no incentive for the nursing program to seek faculty that would get more education and stuff. I mean, okay, if you're talking a PN and all they have to have is an ADN to teach that, I think that's what you're saying, correct? Okay, then that nursing program, there's really no incentive or anything for them to try to have someone with a higher degree because they've met that requirement, so we're not going to go any further. I'm just wondering what would help incentivize them to continue to find someone with a higher degree. That's, if that makes sense. I don't know.
I think that comes back to each college deciding what is going to work best and what the best practices that they set forward. Again, we're looking at this as baseline level and trying to make sure that for those associate's degree programs in those areas that are struggling to find a master's degree and nursing faculty members, they have that option. Because when we're looking at our pipeline, we're seeing that we're getting into some bottlenecking. And we need to be able to look at flexibilities that we can allow more people in classroom sizes.
So the discussion, if I may ask another question. So the discussion with the community colleges didn't actually get down to the level of the nursing, like program administrator. It was more at the college, maybe president. Is that what I'm understanding you saying?
I don't know to what degree Heather took that conversation back down. I just know the conversations that we've had within our membership of their struggles with getting people in, as well as the conversation that I've had with Heather.
It would be interesting to know what the some of the nursing programs.
Madam President, can we clarify what is Heather Morgan's background?
She's doing their government affairs and relational things as
So
well.
she's a liaison,
Mhm.
no healthcare background,
I'm not sure.
not a nursing person. Not
So
sure.
we don't know if she has her master's.
I'm not sure what her educational background is.
And what is the board being asked to do with this information today?
Well, this is just the first point. We can listen to the next point. I think it's, whether or not we would either think about supporting a change. This is how I like supporting the change or what's being taken. I would say, based on what's been provided so far, I think that what you're asking for is already in place in terms of schools to have that opportunity to start there with the expectation that they continue to grow their staff to meet the overall requirements. So I think there are some of the pieces that you're asking for, I think are already in place, how we're set up as a board. But we'll kind of move to the next point.
I think the next thing that was in your packet was related to challenging the NCLEX. That is something that our policy committee decided not to move forward on this next year. It's something that we're continuing to examine with our national policy group as well as internally. So this next session, there won't be anything coming forward with challenging NCLEX.
So currently, the only intent to move to the legislature is the changing of the degree requirements.
Yeah, in terms of modifying the Nurse Practice Act. The other thing that you may have heard about is our LPN to RN hybrid pilot program that we're looking at doing with the community colleges as well. That language, I think, was sent over to maybe some of you that were on the board, and it was a premature draft. It isn't something that we plan to run through the Board of Nursing. It is something that we're doing just in conjunction with the community colleges and that they will have oversight of. It adheres to everything that is in the Nurse Practice Act, but looks at giving more flexibilities to students who are still working on the job as an LPN, and how we're going to be able to differentiate when they're on the job as an LPN versus an RN student, making sure they're still meeting those full clinical hours, but having more flexibility to do that curriculum instruction online, and looking at different options for skills lab on weekends and other alternatives. So out in in those rural areas of the state where we're trying to grow our own, we have some more options with our community colleges out there.
If there are curriculum changes though within the community college, those would need to be approved by the board.
I don't believe there's any curriculum changes. It's just the format in which they would be delivered. And my understanding was that online delivery format is approved, is something that can be approved through. It can't
be. So I just sort of, I think for point of clarification, for additional, like, that it is specific, those specific courses would have to be approved for how they are provided to the students versus an overall online approval option sort of piece. Like, am I right?
If they change anything in their current curriculum that's been approved, they would have to bring it back as a major curriculum change. If the curriculum stays as is, but it's just delivered differently, again, a curriculum change to change the type of delivery. If it changes credit hours, if it changes clock hours, again, major curriculum change. But if they're just planning to do offer different hybrids or, different options in terms of when they deliver it, how they deliver it. Could I ask one additional question related? Because currently educational requirements are they cannot do, they have to have direct clinical care across the lifespan. And long-term care does not provide that.
Right.
So are the community colleges?
Yes, that is what we have drafted in the language, is that they would be finding those.
I guess I'm surprised because we have 24 community colleges that provide LPN to bridge options. Why this, when we already have all of those approved and they have options in terms of when they already have the options when they do clinical, why would they add another type of? I mean, why would this option make a difference when those are already available? Because they would still have to ask for the spaces in their programs. I mean, if, so I'm not sure how, help us
So,
understand how
For
that
this,
helps.
there would be, we would be going to the legislature and asking for a special appropriation to do this. So there would be funding that would be associated with it to allow more classes specific to this, to allow them to stay in long-term care too. And there would be caveats that any of our LPNs that are in a nursing home that are using this program to upskill would continue working in long-term care nursing homes for 3 years after their graduation. So it is one of our grow your own.
Madam Chair, so you're asking for public dollars to be used to staff long-term care facilities and up their educational level. Is that correct?
Yeah, it is a workforce incentive that we plan to bring forward to the legislature this next year.
Okay, I have another question. Have you looked into other educational opportunities that other facilities offer that they take for themselves as an incentive and not public dollars?
Yes, we've looked at all educational opportunities within our membership. This is just something that we've continued to look and examine and figure out what are the ways that we can continue to partner with our community colleges to grow our own. Again, the minimum staffing rule has not been removed, and we're still looking at potentially having to face a 24/7 RN. And LPNs do not count towards the CNA or RN provisions in that rule. So if it were to not go away, we do have some crucial measures that we do have to meet within the next couple of years. And that's why we're looking at trying to take measures now.
Madam Chair, I have a question. Have you talked with, or are you aware of any community colleges that might be willing to offer part of the curriculum on site or in some sort of collaboration with a large nursing home in these rural areas? Because I know that's been done in other states. That would justify some public money based on the workforce shortage.
Right, and this is a statewide initiative. We've done our workforce survey recently and asked how many LPNs do we have that are wanting to upskill, but some of the schooling with having to go in person or different things have been a barrier for them. And this is where this pilot program came across, with our community colleges being able to work together and offer something that is a statewide program to upskill.
I have a question. I apologize for being late, so you may have already covered some of these things. The membership of Leading Age is primarily private, for-profit, long-term care facilities?
Not-for-profit and
They're
government-owned.
All or majority or
The
not?
majority, the few that we have that are for-profit are in the assisted living space, so they would not qualify under this. 'Cause it's
Okay.
for nursing homes.
Okay. You said something that triggered me just a little bit, and it was something to the extent of defining whether a student was acting in their capacity as one type of nurse versus the other they were studying for.
Mhm.
And I want to clarify that because having served on the investigative committee, our position is you are what you are licensed to be, period, or you are not what you are not licensed to be, period, because that's how we interpret the Nurse Practice Act and violations of that. So help me understand that a little bit better. That seems really dangerous for the licensee, frankly. It puts them in jeopardy, and it also creates a really strange area for us when we're investigating. Was this person acting within their scope of services?
Okay, so for us, we would be looking at how, if they're going to do any clinicals on site at their current employer, if they're not there to fulfill hours for their clinical hours and they're just acting in the scope of what they're currently hired as, which is an LPN, they would be clocking in under those LPN hours.
But they're an LPN in the state of Kansas, no matter, they don't take it off when they go to the bar or the restaurant, they're an LPN always, that's where I'm getting.
Correct.
And
So
who's
then
monitoring the clinicals?
that would be the community colleges in conjunction with the provider.
They'd
that
be
they-
there at the facility.
That would be conversation that the community colleges.
So
overseeing
in other
it.
words, I could just come in and say, I'm doing my clinicals today and I'm gonna be an RN, but I don't have an instructor there watching me.
Again, that's something that would be a partnership that would be worked out between the community college and the provider where they are set up to do their clinicals. When they come in to do and act as the student, that's if the employer, this is the other part of this program, is trying to encourage our employers to continue paying them while they are going to school. So even though when they're coming in as a student, they would clock in under a different provision as RN student. And that's where we would be able to say, during this time, they were functioning as an LPN, and under this time, they were functioning under an instructor and learning about the scope of practice as an RN. Now, it would still fall under the community colleges and the providers to ensure that they do not expand past their scope of practice. But that's how we would be able to quickly tell which scope of practice and whether they're working independently or under the instruction of somebody else. It'd be similar to how I believe the apprenticeship program was just approved for.
So Madam Chair, I have another question. So I'm trying to clarify. Does that mean that that clinical instructor at that community college with the RN, it's basically that instructor's hours that are counting toward the RN requirements for that facility to have? So they're congruent with regulations? Is that what's been proposed?
Right now, there are no minimum staffing requirements that they have to meet currently. It's in the process of being finalized. So it's not until 2026 or later that those come into play. So they would not be counting towards those hours in any way, shape, or form. It would not be the clinical instructor counting.
Has that been proposed as a way to provide RN coverage?
I have not heard that in any proposals.
So if I understand correctly, we have other avenues of doing clinicals to get your RN. Yes, you have to go to this facility and work. And the safety of that has been proven. Everything that we've had in place so far has been proven to be safe for the public and generating safer nursing practices. Your organization's proposal is asking us to take the perspective, we're going to work on that. But this would make it where we could get more nurses in. And this would, but I don't know that that increases the safety. And I apologize if I'm out of line for saying that, but, you know, having a master's degree means that you've gone the extra step or working towards your master's. There's a lot to be said for everything you've picked up in that area for you to move forward and teach others. I mean, teaching you to bake a cake is easy. Teaching you what to look out for with a Portacat, you know, with blood pressures and telemetry. We've got wonderful instructors. I still remember my instructors.
Madam Chair, I have another comment too. I know that there were states that in a severe LPN shortage, we want to go back 20 years, even 10. The solution for that in some states was to have the certified medication aid under the auspices of somebody that was an education designed, qualified education person that had literally no direct oversight of that CMA's capacity. It was all on paper, okay? I don't know if you're familiar with this initiative and some of the outcomes with it. The plan had been for those people, and I think it was a 6 weeks training course in some states, then that they would pass the routine meds in the nursing home, and then the LPN would pass and take care of the PRNs. So what was found in the passing of the routine meds the CMA, who had virtually extremely limited understanding of an anatomy and physiology and pathophysiology and medications, would miss cues. Like, as a nurse, when I've passed meds, what a great time to assess a patient, because I have that expanded knowledge and I know what to ask for and what to pick up on. So the CMAs were not picking up on cues. Some very, very bad things happened. Of course, it led to CMS having to take some strong action with nursing homes because of incidents and events that happened. So I guess my concern is, are we headed down a path that could end up having some outcomes that we really don't want to have in our effort to try to staff nursing homes? And believe me, I am very understanding of that. I've worked a lot with those people as a home health nurse in the past. I'm just wondering if we're missing something here more that could be done if we're going to take some action other than this kind of a proposal.
Yeah, I think I agree with you, Dr. Burkhart. As a person who has been a director of nursing in a nursing home and right now leading a team of discharge planners, let me tell you, we do not have enough nursing homes in the entire country. So I agree with you that there has to be something done. I guess, and I personally, as a person who has used my experience to get to the next level, because I did hang out with the people who had the experience and I learned from them. I like this, okay, in its generality. I agree with you. I think there's some safety issues that we have to look at. I think there's some location issues that we have to look at. I mean, you know, if we're doing this in the rural area where there is a dearth of people in general, you know, there might be something different that we do in an urban populated area. So I see that something needs to be done. And I'm not sure what it is, or if it even is surrounding this, or maybe a modification of this, but I do feel like in the next 2 years, we're gonna have a lot of nursing homes closed because an RA cannot work 24 hours. You have to split that shift somehow. And I've been there, done that, where you're on call or whatever for 24 hours. It's impossible. You can't do it. And right now, trying to place people in homes post-acute, or place them in facilities post-acute when there's no bed available. And so now they're leaning on the acute care system to do what needs to really happen in a post-acute setting. So I agree with the problem here. So I don't know if we should rush into a solution versus find something that works for the safety of the Kansas people. And for that matter, every patient that ever will traverse a nursing home ever, for that matter. So anyway.
Yes. I have a question. I'm just trying to understand this a little bit better. So are you saying that we would take a community college that already has a nursing program and not put this into the existing program, but ask them to do this additional program? Is that what you're saying? Or because they would have money to do this additional program? I'm just not sure how this fits in with our nursing programs that we already have. Is where I'm coming from.
Yeah, so it would be looking at how do we hire in the staff to open more seats to get these individuals upskilled.
In an existing program.
Potentially, I'm not sure how the community colleges want to work that out exactly. That's something that we don't have finalized language. We're still going back and forth with them. This is something that we've been working on.
So again, I guess the question that I pose again is who at the community colleges is involved in this, because I just have to wonder if it's a nursing program. I mean, I'll tell you, I've talked to some of the nursing programs about this because I was one of them who knew this I saw the language that evidently it's not totally now. So I just asked some questions and they were not involved at all in any discussion about any of this. So I guess there's a little bit different in community college presidents and the actual nursing program, because from Janelle can back me up, the nursing or the college presidents don't always have a very good idea what's going on in the nursing program and what it takes to run a nursing program. And if you put these into an existing program, but you're gonna be doing them just a little bit different or something, it's still gonna impact their NCLEX pass rates and all of those things. So I'm just not sure how this fits in. That's what I'm struggling with. I'm sorry, I just am.
That's good part, right? Just in terms of, because even if it's a current program and they're adding another pathway, so to speak, they still have to have faculty, they still have to have clinical oversight, they still have to have, like I said, clinical across the lifespan, so it can't all be done where they're currently working. You're gonna have to have the capacity, so they still have to have. I made this comment yesterday, Kansas has 6,490 nursing student seats already. We can only fill about 3,300 of those, because that's the applicant pool we have. And that's the faculty we have. So I'm not sure how, I don't know that opening up more seats is the issue. So I'm not sure how that addresses the issue of we've got seats. We've got programs that already do evening, weekend clinicals, work with different, have to work with different facilities. I work with the colleges that are rural as well as the ones urban. And they may have more difficulty with the educational side of it, but they also have clinical sites to think of, because they're getting the same license as every other nurse and they have to pass the same exam. So I think, to Carol's point, any program administrator is going to tell you that's going to be a concern of theirs, that it still has to be delivered with the same parameters. So how is it going, having another and something that's out, I don't, when you say it's outside the board, that's gonna be run by the community colleges. Well, again, they're under the auspices for any nursing program to come back to the board anyway. So I'm still struggling with how you gain more nurses with the program that probably already exists. So.
And we understand that you guys have concerns related to each of these things, and we understand that your main priority is for the safety of Kansans. We have to find a balance between that safety and quality while also guaranteeing that we're opening that pipeline and looking at different ways. We've been talking about the workforce issue for a number of years, and there has not been any steps taken to start trying to have those conversations of what can we do policy-wise to start looking at changing these things. So for us, bringing these two things to our legislature is starting those conversations and seeing where they develop, what amendments do need to be made, what things can we do. And that's why these two things for us kind of go twofold. We're looking at how do we bring in more faculty with aligning it based on 1 degree level higher, while also looking at how do we have these people that are currently ready for a program, but they're needing something that's a little closer to home with some more flexibility so they can stay working in the workforce. So we're looking at what are the flexibilities that we can do? How do we need to make modifications while addressing safety? And that's why we wanted to just let you guys know this is something that we're looking at bringing forward. But again, as the legislative process unfolds, there's always amendments and there's always things that are changed throughout session. So whatever we've talked about here may not be what we see by the end of session as well.
Madam Chair, I have another question. So in the community colleges that have been consulted, what is the possibility, like on a percentage, if you want to go 0 to 100, of gaining cooperation from existing community colleges to offer a more flexible, more location-based programming? I mean, I'm aware around the US, some very creative options have happened. You're talking hybrid. You're talking weekend, of course, that's the latest thing. you have two cohorts, one's weekend, evening, nights, one's at a traditional. But are you seeing that there is, like a percentage wise, can you let us know what the
That's something I can-
favorability of this might be?
That's something I can take back and find out from Heather. I have not
Okay,
spoken with anybody.
That's,
directly.
that would be very important to me. And then also, if we're talking public funding, absolutely. We have community college director and at least one here in our audience. I think those are things they would want to know. How are we going to finance this? Sure, we're all in, we want to help. But if we're going to offer a whole nother section here with new faculty and on and on and on, you've got to have some help financially.
And it's gotta go from one year to the next year to the next year.
Yeah, sustainable.
So the
funds.
budget has got to be. And right now, I don't think anybody's counting on a steady budget. I mean, we just have to work with what they said we can each year.
So I think this has been very informative. Thank you very much for your time and presenting, recognizing that there are issues in long-term care in Kansas. And as you said, that our end game really is to ensure the safety and welfare for Kansas residents. So those are all the things that's the main point we're keeping in mind as we consider these things. So good questions, good discussions. Thanks for your time.
Thank you. Thank you.
Thank you. So we're gonna, I believe we have a motion for another executive session.
Ask a question real fast.
Yep. I'll be right back. Can you put that on?
That's not sustainable. So sometimes we serve that. I'm just gonna keep rotating.
Yes.
I have the motion for the next executive session. I don't know who wants it. Anyone? So just be here.
And how long do you have to do that? How long do you think?
20.
20 minutes.
So like,
You're gonna come back at 1:30.
yeah. Yes.
Okay, so pursuant to KSA 75-4319B12, I move that the board recess into executive session for 20 minutes and reconvene at 1:30 p.m. The remote meeting will be reconvened by Zoom and in room 509, Landon Office Building 900 Southwest Jackson, Topeka, Kansas 66612. As stated in the notice of the meeting that was sent to individuals who requested the notice and as published on the board's website at ksbn.kansas.gov. The justification is consultation with the board's legal counsel, Assistant Attorney General Charles Macheers, and Jesse Burris, that would be deemed privileged in the attorney-client relationship. The subject matter to be discussed in the executive session concerns the annual review of the KSBN's plan and its submission to the Kansas Division of Emergency Management per Executive Order 23-03. as well as an annual review of the KSB and Information Security Program. The board's executive administrator, Carol Moreland, director of operations, Adrian Guerrero, KISO non-cabinet agency information security officer, Nathaniel Kunst. Did I say his name right?
Yep.
And the non-cabinet agency information officer, Rocky McKenzie, are included as the client.
We have a motion. Is there a second?
I'll second her part.
Thank you. Any discussion? All those in favor say yes.
Yes.
Anyone opposed? No. Motion carries. Okay, thanks. So, on us, we have a motion. This is follow-up for our executive session.
Hi, yes, I have a motion here. I move to agree with the direction the board is going with the Kansas State Board of Nursing Information Security Program and Continuity of Operations Plan.
We have a motion. Is there a second? Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Motion carries. Okay, I don't want to lose sight of the one addition that we had to our new business, which is discussion about putting a date for an additional board meeting for review of the APRN regulations. Do you want to share your information on that, Carol?
Sure. You remember in September, I kind of filled you in on the progress of the approval of the APRN education regulations. Okay, well, they came back to me approved shortly after that meeting, so I started them through the rest of the process. Right now, they're in a 60-day public comment period, but we could not get the public or the public hearing before this meeting. So I apologize. The public hearing is actually next week on the 17th. And then what we'll do, I've already presented to the Joint Committee on Administrative Rules and Regs. They didn't have any comments for requested changes or anything. So after that public hearing, I will get all of the comments that I have received together. We need to put them in a packet for the board to review along with those regulations with the revisions. And then if you remember right, this is on a tight timeline for the U.S. Department of Education's approval. So if we could have maybe a special board meeting, it can be a conference call, really. I mean, there's like 8 or 9 regs, so you would have to go through and do a roll call for each if you're ready to approve them. But then once you get done with that, I can take it further in the process, and I think we can meet the timeline for me to get the response to the U.S. Department of Education. But it's not going to wait till March. I'm sorry, I apologize. It's just the timing of everything. So I just wanted you to look at, see maybe if the first part of January, you could do just the special conference call. I promise you it won't be any longer. And we will get the packet of information out there and just do a push for you before, just say, you know, it's out there, please. Right now, I've only received 1 comment and it's been good, so.
I already thought we had a meeting in January.
Well, there you go.
Are we looking at the first full week in January? First, well, if not the week of January 6th, the week of January 13th. Right, either session.
Yeah.
That's when session starts.
So the week of January 6th, is that better?
Yeah. Only one.
I think the question is pulling out everything together to get a packet out to.
I don't think that will be too hard to do, because if we have the hearing in the afternoon on the 17th, I would think that we could probably have that. It'd be Jill and I putting that together and hopefully out there within a couple of days. And then just give you a push, and that I know that hits around the time of the holidays, but it would give you plenty of time. And truthfully, I don't think there's gonna be too much there to review, but.
Is there anyone opposed or who knows that the issue is really that we need that forum for our
Yes.
meeting? So just want to make sure that we don't have multiple people who say they could not make a meeting that week, sometime that week. Anyone?
Yeah. I'm sorry. I didn't hear.
So the week of January 6th sounds like it's open
Okay,
to your discretion.
as far as I know.
Earlier in the morning would be better. And on Thursday morning at like 8:30, we have app call, so that usually lasts about an hour. So Juliana would be
Not
busy
Thursday
with
morning,
that at 8:30 to 9:30.
The only problem might be with that one is I got a summons for jury duty that week. Sorry, that just came in the mail this week too. So but I'm a higher number, you know, like in the 20s, so hopefully I won't get called, but that's just, I'm summoned for jury duty that week. So somebody else might have to do it if I'm not here. Sorry, there's nothing I can do about it.
That's okay, as long as someone else would have the information to share, and it's not that we couldn't move forward
Janelle
without.
could, because I could have everything. It's, yeah. And
Okay.
Jill knows all about the roll call and stuff like that. So
And they're budgeting.
we could make it work.
No site visits till the end of the month, so.
Should we do Monday, Tuesday, end of the week, Thursday, I guess, not Thursday.
Not Thursday.
Not Thursday.
Preferably not Tuesday afternoon because I have something on that
How about Wednesday morning?
Wednesday morning.
Wednesday, January
Okay, that's our in-staff day.
Yeah,
Oh.
first in office thing.
We can do it.
We can do it though. I mean, we're not, this conference call's not
Yeah,
gonna
in
be
the
that
morning, because
long.
our staff meeting.
And if we do it in the morning, our staff meeting's in the afternoon. I mean, it's literally just to do a roll call on every one of those, unless you have a discussion or you want changes made.
But Wednesday, January 8th, can we say 9 AM?
9 AM? Okay. We will, push out when the packet's out there, just to tell you to check your emails, and that will contain, the conference call number. Does that sound okay?
Yes.
Unless you want it streamed or something, then we could have Colton set up, whatever.
Yeah, we can do that.
Are you open that day, Colton?
Oh.
Yeah. Okay.
Yeah, we can stream it. We'll give you all that information when we,
Said 9 AM.
9 AM.
we'll make it just as short.
Okay.
Thank you for doing that.
Thank you. So I think our last item of new business is the refund discussion.
Yes, I asked to have this on because I just want to make you aware. I know throughout maybe the last couple of years, I just shared with you how much we refund, how much money we have tied up in refunds. And just to let you know, for fiscal year 24, we did 582 refunds for a total of $53,948. So far in fiscal year 25, and we're almost halfway through, we've done 281 refunds. And it's been $28,803. I'm bringing this up. I'm gonna have Ray talk probably a lot more about it, actually. But I'm bringing it up because right now we refund the money that they give us for an application. We don't keep any, we refund it. Although our staff has taken the time to process the application. When we do these refunds, that takes some of licensing time. It takes a lot of Jill's time. And there's probably 2 other agencies that are involved with us getting the payment back to the person. So, yeah. And it gets real complicated when we have a bad check and crap like that. But anyway, so I'll let Ray just kind of, give more detail.
So actually, I have to sort of clarify what Carol said. If we've processed an application, we do not refund that application. What actually brought this on, I want to bring to your attention, we had an initial applicant. She submitted her application back in June. We processed it on June 27th. She submitted her fingerprints July 8th. Those were processed. We received a transcript without a degree or date. Or graduation date on August 15th. I saw emails between the applicant and the initial clerk for 2 or 3 weeks. They had responded back and forth because she had told the applicant that she didn't have a transcript, and so we could, with the correct information, so we could not make her eligible. And the applicant wanted to have the school submit a letter saying that she completed the requirements. We told her that we would not accept the letter. We needed a transcript with that information on it. we didn't get anything from the applicant, so at this point, we're assuming that the information is coming. Because we haven't heard anything, we've told the applicant what we need. I got involved with this because on November 18th, the applicant actually called because she was requesting a refund because she had gone to Tennessee. She had gotten licensed in Tennessee and she was never licensed in Kansas, and now she wanted a refund for her application. And I told her, no, we would not be doing that because we had worked on her application had at that point had been processed for 5 months. We had corresponded with her for 3 weeks. We had told her what we needed. She chose to go elsewhere, which was fine. That was her choice. She told me that, we made it very hard for her to get licensed, which I found very hard to believe, considering I saw the emails asking, you know, we told her what we needed. We told her, you know, what we didn't have, and she understood. We just never got it. So it's these kind of requests that we're seeing more and more, which are sort of outrageous, that are kind of just making my head spin. So I started to do a deep dive, and it was after this one, on this same day, we had another one. She had submitted a reinstatement application May 31st of 2023. Didn't check on her application. Our applications are good for 6 months. It abandoned out. She checked on her application, same thing, November of 2024. She wanted to transfer her application fee from 2023 to a 2024 application. We told her no, we would not do that. Because, you know, well, actually, let me back up. So, and I had gotten those 2 requests in the same day. So obviously, I spoke to Jill because they're right. You know, once we decide that we have to do a refund, we have to go in on our side of the system. We have to physically go through the system. We have to do the refund. We have to send the information over to Jill. Jill has to send it over to Carol. Carol has to approve it. It has to go over to CanPay. It has to go over to be approved by them, and then they have to send out a check. So it's not an easy process for anyone. Okay, so what I was looking at was for August, what we have done so far since the last board meeting. August, we did a total of $5,621, 54 applications. September, we did 4,793, 50 applications. October, $4,938, 50 applications. November, when I was putting this information together, we had done $4,136. That was 38 applications. You know, the number that we are giving out for refund, I mean, that's a salary. That's a full-time person. That's a person.
What's the most legitimate reason people request a refund?
So, okay. So what's interesting is, then that's why I wanted to clarify what Carol said, because if we process the application, here's the thing. Our processing time, we process within 7 to 10 business days. What I find so interesting is when people submit applications and they don't check on an application or they don't do anything, they say, you know, they check 9 months later and they say, well, what happened to my application? Well, we never got fingerprints. Well, nobody told me I had to do fingerprints. Well, but we didn't tell you to submit the application either. So I feel like there's some accountability that's not happening. Like, I mean, there's some, I mean, true that, you know, we are there if you guys submit something and you have questions or you want to reach out to us. But so a lot of what we're finding is applications that are not needed, duplicate applications, submitting wrong applications, pay for applications twice, sometimes more. We have people who they renew 7, 8 times just because they keep clicking. Even though it only tells them to click once. And wait, only to submit once. Once they register in the portal, any application that's submitted, they can view the checklist. On every single checklist, it has the abandonment notice. We have looked over those web pages. I have tried to make them as simple as possible. I have tried to put that it's good for 6 months. On the webpage, anywhere you go, the staff directory is listed. So, I mean, the information is out there. I feel like it's out there. I feel like a lot of it is that they're just not reading or they're not researching or they submit, because I cannot tell you how many emails I get that they're like, well, I've submitted my application, what do I do now? And I'm like, okay. My question is, and I want to ask this, but I don't, but my question is, how did you get to submit the application without looking at the requirements for the application? Because if you can submit the application and you can get to the portal, but you don't know what you need. So I just send them the link and I'm like, okay, this is what you need. You know, if you look at this link, you'll find all of your requirements. Let me know if you have any questions. I mean, I feel like our website is very simple because I need to make it simple for me and for the staff so that we can point people to where they need to go quickly and easily. I also remember, in thinking about this, I remember when we were first starting Compact and we said that, you know, this was new, it was going to be a change. It was a lot of information, you know, that was 5 years ago. I mean, we've been in Compact for 5 years, over 5 years. And I also feel like the staff really takes the time to hear the feedback. I have gone to Adrian, Carol, Colton several times and said, you know, this is what I'm hearing. This is what we have to change. You know, when things change, like with the APRN, we need to put it on the application. We need to put it on the website. We need to put it in the newsletter. We need to put it everywhere so that they can see it. When we have program administrator meeting, we go out there and we say, you know, I came up last year with an idea that I asked all of the schools to present, okay, when you send in your ATTs or your transcripts, send me a list of names so that I can give them out to all of the licensing staff so that when your applicants call in, even if we can't go through transcripts because that's impossible, especially for July classes, we can at least have lists and we can say, okay, we have your name on this, we got them on this date, you should be processed by this date. I will tell you that out of all of the Kansas schools, I had probably less than 10 send us lists. And that's fine. That's their choice. I know that they're busy, but I feel like we're trying to come up with ways to help them. I feel like we're trying to come up with ways to say, you know, we want to help you, help us help you.
Well,
So-
I don't think it's unreasonable to charge an administrative fee or something. That's just standard practice in the corporate world, and I think people expect that, but I don't know if that's legal or not, but you are expending a significant amount of time, and I think we just either set what the amount is or it's non-refundable.
Well, places charge restocking fees. I mean,
Well, okay,
literally,
and so
out of your-
here's
out of
the
your
other thing that I thought was really, really interesting, because I did a lot of research on this, you guys, I was very excited. So I looked at all of our neighboring states just to make sure that we were on the right path. Missouri, Oklahoma, Colorado, non-refundable, non-transferable. So what's really interesting about this is I even had to dig. It's not on their website, it's on their application. So if you're not reading the actual application, you're not seeing it. So, I mean, even for me, that's like, where is, you know, you have to read, you have to take the time to look at the information. You just do. Nebraska is very interesting. I was looking over their policies and I feel very bad for their staff. Because they have this like sliding scale that they tell their license applicants that, yeah, that they need to determine when their license is going to be issued. And that a license should take between 8 to 10 weeks. And so if they fall between such and such month, they pay this fee. And if it's the other months, they pay this fee. And I was like, oh my God, that poor staff. Yeah, I don't know how they keep any staff there. Theirs is a little bit different. They say that they're also, Adrian did tell me that they're under an umbrella board. So they're under the Division of Public Health, which sort of makes sense because they have to do several agencies. But the applicant can request to withdraw the application, but they only have like 5 days after it's submitted. And so then I did a little bit closer to home. Okay, so dental board, non-refundable, even Board of Healing Arts, no refunds given. Board of Pharmacy will not refund overpayments. I thought that was very interesting. And that's their language. Fees are non-refundable. Also, did you know the Board of Pharmacy, you cannot apply online?
Yeah.
They are in the Stone Age. Go back to them. I was just like, wow. So yeah, and even in looking in these states' website, I'm just like, I think our website is very, so I'm like, how do you not see? How do you not see our information?
So that, yeah, that's the question.
Yeah.
So I think if it seems that we're in line, that we would not be out of line by asking, like, needing to be non-refundable and say, what's the process? Like, what do we have to change to make that possible? And what will the process?
Charles,
Well, yeah, I'll talk to Charles. I've talked to him some about this.
You'd have to vote on it, one, but most likely you need to change one of your regulations to include that. And we can study the other boards and see what they've done.
Does our regulations say that we do issue refunds, or is it just silent?
It's silent.
So then why would we have to put something in that says we do?
Because this is something I had to learn in contract law, like when you sign a private contract. If something's not referenced in a contract and it's silent, it's fair game.
Okay.
so
With-
like,
With
in,
statutes and regulations, this is the board is a creature of statute. So anything that is not in a statute that says you can do it, you cannot do it. So if it says, unless it says like the board president is allowed to breathe air, they cannot breathe air
So
unless.
our
the
other
statute
board
says so.
colleagues, you're saying, so
So,
like Board of Healing
yeah,
Arts,
so
Pharmacy, they have it.
You
in
have
red.
to have something in a regulation or the statute that says you can refuse to give refunds.
So in our 60-4-101 regulation, payment of fees, somewhere in there, it would need to say, and no refunds are.
Just slide in there, just
Okay.
put non-refundable
Non-refundable.
fee and that. would be-
Okay.
I would actually like to ask if we could do maybe non-refundable, non-transferable, and maybe at the discretion of the staff. Or something, I do like how, Board of Healing Arts, however, if there are extenuating circumstances, the licensing administrator and our deputy licensing administrator will consider the matter. The only reason that I say something like that, it doesn't have to say that exact language, but like right now, because of the fact, like a good example is our military. The military spouse, that they have to pay that application fee right now, and we have to refund it because pursuant to that, they don't have to pay. So I feel like
Do you need to have that language if you have something else in place that makes
Covers
it
that
not,
part.
because
Good
to
question.
me, like, then you're just
Opening
opening
it
up
for
like
argument.
for
Yeah.
like some other thing. So if you have that it's non-refundable, but yeah, you have this piece over here that says military and military spouses cannot pay, then to me, that negates this non-refundable.
The other one?
So you don't have to say, I'm not an attorney, so help us out here.
We can make sure it all jives.
Yeah, with statute.
The military section is statutory, so
Yeah.
that trumps everything.
So it
And
does
if there
over
ever
this.
was like a technology issue or something, things come up occasionally. Would we still have the option to
And you could,
handle that?
we'll do a little more research on it to see, but you could also make it discretionary and you could say you may not refund. So
Like if
we
you
can look to
click 3
see what-
times.
There's, I mean, lots of people have thought of that issue before, so there's plenty of language to look at to see what.
Because if we could do that in the case of the initial applicant or the reinstatement, we could say, no, we will not refund, and this is why.
Yeah, like once it's been processed, I mean, once you've spent the man hours to
Yeah.
process.
Absolutely.
In the concealed carry unit, it just says non-refundable fee and that's all it says. So no matter what, they're not gonna get there. Right.
So can
There's
we,
no
if we're at a point, can we make a motion that you want to explore the language required to modify the regulation?
Yeah, you can do a motion like that right now.
Madam Chair, I move that the board request that our legal counsel and executive administrator and licensing supervisor develop proposed language in for a regulation that would state our intent to make application fees non-refundable with some degree of discretion.
You need to write that.
Adrian's trying.
Who's second? Shelter. Seconded. Any discussion? All those in favor say yes.
Yes.
Anyone opposed? No. Any abstentions? Motion carries.
And we'll bring that back in March. A revision, possible draft revision for you to look at.
So that takes us to our March agenda item, draft revision. Also in March, is sort of the final information about strategic planning meeting. Are we also getting closer to an update on the, do we need to review the regulations reviewed by committees and want to carry that over to the next?
You can, yeah, well, there'll be a few that will not probably be totally. They would be finalizing that meeting. So if you wanted to look at all of them in June, because I think I have to submit the report like July 15th or something like that.
Okay, so maybe we can push that till June.
Okay.
All right.
Probably an update if there's any legislation or something going on that might impact this kind of the progress. It sounds like there might be some. But yeah, and we should, maybe we'll have the annual report and first newsletter and stuff like that, maybe. We'll see. A little bit more information about that.
Else. All of them.
Don't forget your new laptops.
Where do we have to go for that, back downstairs?
Back upstairs.
Back upstairs.
Into the library.
Sorry, I did that coming from lunch.
I know.
by the way. I was
But
playing on the.
Take your old ones because they're gonna leave them, right? So take all your stuff with you.
Thanks.
Tony's up there,
Have a good Christmas.
ready for you.
Thank you.